Welcome back. We are ready to conduct our follow-up visit. And we've structured things a little bit that the doctors will be acting together and acting as one doctor. So they'll be tag teaming it. It'll appear they will work together as one clinician delivering the visit to our patient, Mrs. S., and her son.
So you guys are Dr. Smith. Let's just call Dr. Smith.
All right, so is everyone ready to conduct the follow-up visit? Very good. All right, let's get started.
Hi, Miss S.
Hi, Dr. Smith. How are you?
I'm doing well. How about you?
I'm great, thank you.
Nice to meet you again.
It's good to see you again.
Good to see you too.
Thank
You look good.
Thank you. I feel good.
That's good. So what's going on?
I don't know, they told me I had to come here today, and my son picked me up. He's wonderful. He's wonderful. I love him. Isn't he cute?
He is.
Yeah, so I got in the car like he told me, and I'm here.
Perfect.
So he told me I had to go see the doctor, so
you're great. Perfect.
I feel fine.
That's good. So how are we coming along on the medications that we started at the last visit?
Why are you looking at me like that?
Well, why don't you tell her about your
Oh, what?
medication and what you were...
Oh,
what
that
you were-
stuff.
Yeah.
Oh, that.
Tell her a little bit about
I wasn't sure what she was talking about because I was taking other medicines too. Still taking all my other stuff.
Okay.
But the stuff that you guys gave me, oh my God, forget about it.
What
I tried it. Oh, I tried it.
So what was
The one that started with the T, that,
The trazodone?
yeah.
Right.
Holy cow.
Okay. How did that make you feel?
Like a drugged dummy.
Okay. And especially in the mornings or?
Oh, the mornings came and went. I didn't wake up until 1 or 2 in the afternoon.
Okay. Okay.
And then I was just like a zombie.
Okay.
I can't take that stuff. You wouldn't want me to take that stuff if I felt like a zombie.
No, we don't want you to feel like a zombie. We want you to be
No,
more
I couldn't do anything. You know, they're always on me. I don't do anything. Well, that medicine, I couldn't even get out of bed.
Okay.
But the problem is with regards to her not taking the trazodone is, I know you said before
Right.
to cease the Tylenol PM,
Okay.
but she's taking it again.
Well, I get to sleep, for God's sake.
Okay. Were you by any chance taking them together?
No, I tried it your way. I tried it, that horrible stuff.
Okay.
And when I finally decided that I couldn't live like this,
Okay. And what
I
about?
went back to what I was doing for years. I've taken that stuff since I was in my probably early 40s.
Okay. All right. Well
When
enough.
when him and his sister were just little brats driving me crazy.
And it's more
that's why
familiar to you.
I love it. It helps me sleep.
But Mom, there must be a reason why doctor wanted you to take the trazodone instead.
Well, maybe there is, but I can't take that.
Okay. So we'll talk about that. And then what about the other medications in episode? The one that we started low at 5 milligrams and we wanted to increase it.
Oh dear God. That stuff put my GI tract in an uproar.
Okay. And
You know, they're always on me. I gotta eat, I gotta drink, and then this drug just made me sick.
okay. Okay. So it didn't. Both of the drugs didn't agree with you. Right?
No, not at all. They were horrible. You wouldn't want me to take those. They were making me sicker. First of all, I wasn't sick. There's nothing wrong with me.
Okay. So let's go over both of those medications. First of all.
Okay.
Touching base with your Tylenol PM, right? You told me that you've been taking it since you were 40,
Yeah.
but now you're 70 years old, right? And
70 something.
yes,
Yeah.
so
70 something.
70 something, and you look good for 70 something.
I know I do. I feel good for 70 something. I'd like to see you get to 70 something. You and that snotty sister of yours.
But unfortunately, even though everything is still the same, our bodies inside, they slow down. The
Well, I know that.
Yeah, so
For sure.
the metabolism, the body, the way the drug is processed through our bodies,
Yeah.
that differs, like that decreases so at 40, your body was able to clear Tylenol PM very quickly.
Okay.
But now it stays in your system longer. And
Maybe.
yeah, and the
makes
Tylenol
sense.
part is okay, but the PM part of it,
Oh.
yes, the one that makes you sleep.
Oh,
Yeah, exactly.
that's
So
the tricky part.
that's the tricky part, and that stays in your body for a longer time, and that can cause more issues that we're dealing with. That can cause issues sometimes like with memory, like he's concerned about. So that could be coming from the D part of the PM part of the Tylenol PM.
Oh,
That's why we changed it to trazodone, because it's now I don't negate that it made you feel horrible, but
Oh.
yeah,
well, it made me feel like a zombie, like
Right.
a drug zombie.
right.
I was,
So
Did you take trazodone, were there days when you just tried trazodone without taking the Tylenol PM?
I never took them together. I did what you told me, Doc. I did what you told me. I just took the one, and I tried it more than once, and I was sleeping.
Okay.
But I was sleeping till the middle of the next afternoon. I couldn't do that.
I think one of the things with regards to that is obviously because she felt drugged, she was kind of inactive and she just wasn't herself. So I was just wondering, and we were just wondering if there's something that we could do.
definitely. So we started you on 50 milligrams, and with some people, maybe you just need 25. So we can try halving the dose and see if that works for you.
Is that as low as we can go? Could we even go lower than that?
That's
You know, I'm pretty sensitive to drugs. My body's used to what it's used to, but I don't know about so much.
definitely, we get more sensitive as we age, but
Well, I would think so.
Right, but
Yeah.
that's the lowest effective dose that we say.
Oh,
Yeah, so it is, right? Yeah, so that's, we start on that, and then you can just give me a call. So instead of stopping the medication, just call me within a week to see how you feel, and we can work around it. We can see that if this medication works for you, if not, then we can maybe try a different one, because we need you to sleep as well. I don't want you to be up all
I
night.
need to sleep.
Exactly, and that would impair your functioning further. if you
Yeah.
don't sleep.
So just to be clear, just so we're aware,
Right.
okay.
we're not taking the Tylenol PM anymore?
No Tylenol PM, because that, like I said, the PM part, it's not good for you, and.
I'll try.
Yeah,
I'll try.
definitely, that's good.
That's all I can do is try.
Yes, and we'll work together. You can always call me, and then I'll run you through the side effects and see how things are going. And then maybe you can take this medication a little bit early on, before sleeping. At what time do you go to bed?
9 o'clock.
Okay. So yeah, it has a half-life, and it eventually gets cleared from your body. So maybe we can start, like you could take, and at what time were you taking the trazodone?
I might have been taking it a little later, because
Yeah.
I didn't wake up until 4 o'clock in the
Got
afternoon
it.
from the night before.
Got it. So you were taking, so that's the cycle. Now you see,
Yeah.
we'll take it late, and then in the morning, the effect is still there. So let's just stick to, like, if you go to bed at 9, let's take it at 8:30 or 8.
Okay.
And that would at least make you at least more alert in the morning when you get up.
All right, I'll try the 20,
Right.
you said the 25.
Exactly.
Now, doctor, are we gonna worry about, the Neprazole, right?
Yes.
Are we gonna have to are we worrying about
Yeah,
that
put
right
me back
now?
on
or
that
are we-
stuff too.
okay.
So that's what my next topic was, like to talk to you about that. So what we can do is, I know that made you didn't feel well with the GI side effects, and which is not
Yeah, it was
pleasant.
awful.
Yes, exactly. But that medication.
Did you ever try it?
No, I
Nasty.
haven't. I know, I understand, like, and I totally understand it would.
Uh-huh.
But I've tried other medication which cause similar side effects, and they're not pleasant.
No, they're not.
No.
Yeah.
But the importance of this medication is, like, last time we discussed about the diagnosis of Alzheimer's dementia, right?
I don't know, did we?
Yes,
Yes.
yes, we did, Mom.
So that's why we started you on
Oh,
this
you told me, because, yeah, I remember, because I said my dad had that, but he was 80-something.
Mhm,
I'm a little young,
mhm,
but maybe not.
yeah.
So it's different in different people. Some people can start having the signs symptoms a little bit earlier.
Yeah, I think you told me that last time, too.
Yeah.
I think so. Yeah, see, I can remember a while
You
ago.
can, exactly.
Yeah, 3 months ago, but
Yeah.
Yeah.
they tell me I can't remember what I ate yesterday, so I don't know. I don't know if I believe them. but-
So what are we gonna do with
I don't know,
regards
what
to
are we
that?
gonna do?
Is there something,
So
is there
that-
another drug to take, or what are we gonna do with regards to that?
There is, so you just tried this medication for 2 weeks, right?
Yeah, isn't that long enough to have your GI system in an uproar?
And how are you taking that medication? Like just empty stomach? How are you doing it?
What did you tell me? Did you tell me to take it at night or in the morning? I don't even remember. I don't know. I probably just
That doesn't matter.
took it with the rest of my pills.
I think you took it first thing in the morning, to go exactly opposite of the trazodone, because you were
Oh, yeah, well,
taking both
got
at the
it.
same time. So I think you were taking that in the morning.
Yeah, oh, Jesus.
And-
That makes sense. See, I'm pretty smart.
You are. So for that, the only reason we want to try that medication is because it can slow down the disease process. So that's why it's
Well,
important.
that would be a good thing.
Exactly, that's what we want for you, right?
Yeah.
So sometimes taking it with food helps. So if you want to take in the afternoon, it's a 24-hour drug. So once a day. So we can try that, taking it food in the afternoon, because if you don't have
Take it when I eat lunch.
you can take that when you eat lunch, you can take it with breakfast. So,
I
but,
don't always eat breakfast. Sometimes I sleep through that one.
so lunch works perfectly. Do you think
Okay.
you'll remember taking medication
I
as a
suppose, well,
Well, if not, I would.
they set up my pills
Yeah.
for me.
Anyway,
So they'll just put it in a different,
Perfect.
in a different box. They'll fix it.
That's great. So let's try that.
Okay.
And then usually the thing is that you'll try 5 milligrams for a month and then your body gets used to it, we increase it. But I'll touch base with you in a month. And you can call me anytime and then let's see.
Do I have to come back here in a month then?
No. We can touch base over the phone to see how you're tolerating the
If you have any
medication.
concerns, we'll.
Exactly.
Okay.
And if you're tolerating it, we'll go with the higher dose. If not, then we'll give it more time.
All right, I'll try.
Perfect.
Now, on to other stuff, Doc. We
I
are,
love all this whole.
we are having some concerns with regards to some of the things that she's doing around the house.
Like?
There was one time where she left the stove on.
Haven't you ever left the stove on, for God's sake? Or are you perfect like your sister?
Okay, but that was only one time. We don't know any of the other times. There could be the potential more of other times. It was the one time where I came in and I saw it on. So I'm just concerned that a fire may start, and I don't want you to get hurt. So that's one concern. And then another concern is it seems like, and I know that we just talked about the medicine and this was part of it, but you're not really going out anymore. I mean, before you were a teacher and you used to do stuff and you used to socialize, and now you're not really doing anything at all. So that's one of the concerns that we
I
have.
was a teacher for a long time. I worked really hard.
So
And I just-
are you concerned about all the things that your son just mentioned, and he also told about that you went in the car?
I'm not concerned about the stove,
Okay.
because everybody forgets to turn the stove off once in a while. I don't care what he says.
But that's the one time that he noticed. But what if, as he said, that there have been other
Well, I haven't
times?
burned the house down yet. I've been living in it for 50 years.
Mhm. And what about going out and forgetting where you were supposed to go? Is that something that concerns you or no? Because that's what.
Did I do that?
Well, okay, so we don't know for sure if you were doing that, but there is a concern because you went out and you told us that you went out for groceries, but then after, when you came home, we came back and there were dents on the vehicle, which we hadn't seen before.
Well, maybe somebody hit me. How do
Okay.
I know how they got there?
Do you remember if somebody hit you?
No.
Even if you don't remember, that is something concerning, and your family is definitely getting concerned about all these little incidents.
Well, if they're that concerned, they should get the car fixed then.
It's not just about the car, it's about your safety. That you are not leaving the stove on because that's a fire hazard, or you did not get into an accident and hurt yourself.
So now what?
So now, that's the thing, that's what I was coming to, that you live alone at home, and your family thinks that this is not a safe
I'm not going anywhere.
No, I'm not
You're not
talking.
putting me away.
No. We are not talking about sending you somewhere, but we can definitely offer you help. Even at home, we can have social worker arrange some visiting nurses who can come and take a look at you once a day, or maybe even less frequently if that is something that you are.
What do I need a nurse for?
Just to come and check. A visiting nurse's job is not only to come and take your blood pressure or give you medication. They can just come and check up on you and check up on things around the house. Is that something that you are agreeable to? Or we have different options available as well. the social worker can come in and talk to you about different options that are available.
I don't need a nurse. What do I need a nurse for?
I think what the doc said is that it's not exactly a nurse, it's just to make sure, to kind of check on and making sure everything's okay. Because I can't be there and Leilani can't be there, so then what's...
I know, she's
so
so busy.
We can't always be there, so sometimes we need other people to come
Because
in
your
and check on
family is
you.
definitely getting concerned about you.
Well, I don't think I need a nurse, but, you know.
Yeah.
But I don't know, if you think somebody needs to come in and check me, that's fine, but
Just-
not a nurse. I don't need a nurse.
Okay, well, it could not be a nurse, it could be just a social worker who can come at your house and take a look at what, if your pills are arranged properly. whether
They do
there's-
that. I
But-
couldn't do that. I gave that up a while.
You said that there's a social worker here that we can talk to, right?
Yeah, definitely.
Would you mind talking to the social worker, or maybe we
Well,
can figure
apparently you
something
think
out?
I need help, so
Well, no,
yeah,
I'm just
talk to
asking
them.
would that be something that you
Yeah, we
would
don't
do?
need to waste the doctor's time. Let me talk to the social
I
worker.
don't think we're wasting the doctor's time.
Well, the doctors take care of my medicines. They've talked to me about what I need to do with those. She's explained to me very nicely why my Tylenol PM is a bad idea. I don't need a nurse.
Who's there?
Your next patient is waiting.
Okay.
But, okay, so I think that they're just trying to help. So I'm not, and I'm not trying to put words in the doc's mouth, but I think they're trying to help. So,
Okay.
and maybe having a social worker to discuss this next thing that we can do.
Okay.
And maybe we can find somebody other than a nurse.
I don't need a
And Alzheimer's is not a diagnosis which can only be treated with medication. There are other things that are involved in patient's care
Okay.
as well. So we
All right.
have to make sure that all the components are taken care of when it comes to Alzheimer's, as we talked about last time.
And just an extra help around the house.
Dr. Smith, you're really doing your job. Thank you so much. Okay, well now they can take care of somebody that's really sick. Thank you so much for your
You're
time.
welcome, and we'll reconvene in 3 months and see how everything is working.
Okay, thank you.
You guys, we'll finish up, but we've seen this exercise done a lot of times. I think you did fabulously. Linda, I can't help but ask, what was going through your mind when everyone was identifying their concerns about you? Everyone was identifying, properly so, but telling you that they were concerned about you in one way or the other. What went through your mind in that moment as a patient, having all these people telling you that they were concerned about you?
Well, I think my typical response is, it's a mixed one. It's, well, it's nice that they're all concerned about me, but it's not nice that they're telling me what I should do. It's nice that they explained to me why I should do it. That was really important. And that turned me right around because the doctors took the time to help me understand why what I've been doing for 30 years, taking Tylenol PM, may have worked when I was 40, but not a good idea to do at 70. And I think if we can give people who are our patients a sense that, they have some control. And it's our responsibility as providers to help them understand why we're doing what we're asking, why we're asking them to do what we're asking them to do. It's our responsibility to get them, to get the patient on the same page. And I don't think this is unique to a diagnosis of dementia. This is unique to a diagnosis of anything that's going to have such an impact on a person's, you're talking about lifestyle changes.
Yeah.
Taking medicines are easy.
Yeah.
Lifestyle changes are not easy.
And we see this with any disease like diabetes, high blood pressure. Lifestyle changes are the most difficult thing that the patient have to undergo.
Do you typically find that level of resistance? So for people with dementia, and for those that you're, how authentic is this experience compared to your routine experience? Because when I was down there last time, we were saying that's much more typical of a patient visit. What we're saying, rather than the compliant video you saw. how does this compare with your experience with having an office visit with someone with dementia or with their family member?
I think it was spot on, because that's what we were talking, like, they do not have that insight into their diagnosis. And it's like all of a sudden everybody's talking to them like you need to do this, you need to do this, and you're not safe. So when your entire life you've taken care of your kids. So it's kind of a baffling experience for patients. So it's pretty regular
Yeah.
what usually patients exhibit.
I loved how you listened to the son,
Right.
but you did not look to him. So if this might be a typical reaction for someone with a cognitive impairment, and you didn't feel unheard, did you, Mark? Or did you?
What I felt is, since this was new to me, the diagnosis and being unsure, I felt like I was out of sorts because I want to find help for my mother, but at the same time I don't want to offend her by saying something to you guys that she won't take that way.
Right.
Because now I'm taking her home.
Right.
And I'm gonna give you help.
So my concern is, well, what can I do possibly to help the situation, but at the same time not feel that spite, which is common with caregivers. They want to get all the help possible, but at the same time, there is still that. I mean, to the doctor as a patient, but that's my mother, that's my father, that's my sister, that's my brother, and we see that other side, and it's so. It's that fine line. So we're looking to you guys. So the fact that you guys brought it up, and you weren't just talking to me, but basically I'm saying, talk to her. That helps so much more because it helps strengthen what our concerns were, because you have the same concerns.
And you brought up one of the things that's most difficult for families to bring up is literally being brave enough to bring up the concept of having someone stop in, maybe just once a day.
Yeah.
Yes.
Well, just and it doesn't need to be a nurse. No, you don't. And it could be another type of person, but once a day. So just that alone is just to open that conversation alone is huge. And one of the things I thought you did just exceptionally
We've
well.
done this scenario numerous times, and you guys just did an exceptional job.
Thank you. Yeah,
Excellent.
usually if this was our clinic, we would have, usually we schedule a 30-minute visit for something like this. Because so we can do that. So if we have space, we can definitely schedule a 30-minute appointment, and then going over, explaining the patient everything, then addressing family members' issues exclusively, okay, we talked about you, do you have any questions? And then let's see what his concerns are, let's see if you guys can work them out
So
together.
you do have time in the follow-up visit after an initial diagnosis.
If we want, we can definitely schedule that particular visit.
And we also have social workers.
I was going to ask you that.
Yeah.
Remind me, you have social work support in your office.
Yeah, and they can, if they are in the clinic that day, we just call them and they come over from the other side and go into patient's room right away and talk to them,
Right.
So can we link up with them and provide them with some additional resources that they might not be aware
Yeah,
of?
this is something that we need to talk to Carrie about.
Yes.
Now, I know that you said that you were possibly staying in the Olean area. Would you feel like what we're doing as part of the center, is this a valuable resource to keep it going with the providers?
Definitely.
Okay, because one of the things that we're concerned at the center, one of the things that's very much a concern for us is, it's great that things are going on in Erie County where neurologists are, and it's great that you have all these resources in Erie County, but what about in counties that aren't getting
Exactly.
those
So
resources?
please don't hesitate to call if you meet a colleague, you start your own practice, you see something in a hospital, you see something EMTs, or literally almost any type of clinical practice, right? Filter back to that primary. So please don't think that we wouldn't come down, or we don't have enough people, or we can't set up a webinar or a seminar, or before anything, so I didn't mean to interrupt you, Mark, I wanted to offer that up. Because I have to go, I have to scoot out of the room, and I'm really sorry. But I've got the evaluations, but I also have the, there's just a general overview of the ICD-9 code. It's called GO 505 in here. And also an article on capacity and decision making. So there's more to come for you. I'm sorry to interrupt, but
We'd like to thank you for being part of these sessions. I hope, like I said, I hope you guys got something out of this, and we look forward to collaborating in the future.